Welcome back to the show. Liz Curran joining us here today. Excited to have her here live and in person on the Zoomcast as well. She's the co-founder of Health Navigators, and she's local to us because she's right outside Center City, Philadelphia, in Haddon Township, New Jersey. So welcome to the show today. How are you?
Thank you so much for having me back. I'm thrilled to be here.
Same here. Let me have you introduce yourself to our listeners here today to start.
So, I am the founder of my private coaching practice called the Health Navigators, and we work with cancer patients who are looking to adopt lifestyle change into their healing plan, regardless of treatment type and regardless of stage and regardless of diagnosis. And we welcome, obviously, as we proceed to talk through some of these things, the work that I do is really relatable to everyone, and anyone that's looking to support their wellness.
And you say you're here to help those along their healing journey. If you're feeling overwhelmed, uncertain due to this life-changing diagnosis, let you know. Reach out. You've been doing this, you said, for a while, helping people, and I would like to hear a little bit of your backstory. What got you
Sure.
into this, if you don't mind, and
No?
share a little bit about your own journey and your family as well.
Yes, absolutely. So, Health Navigator was born in 2020 at the turn of the pandemic. We found that
Hmm.
there was a need for social connection, as well as people were really ready to dive in and really take kind of their health into their own hands by lack of options. But we really embraced that opportunity, and we're so thrilled to be able to bring our work virtually, which had been kind of more in person prior. So how I got into this work actually just about 10 years ago, in 2014, my sister was diagnosed with a very, very rare, very aggressive breast cancer. And at the time, we did not have much family history of cancer. It was very new to us. We didn't have a path or a plan. We just, kind of learned through the process. And she had been diagnosed in January and passed that same year in December. And it was just a very emotional time, obviously, but it was like a education of the conventional medicine system and all of the wonderful things that they had to offer, but then there's also
Hmm.
some limitations where we can kind of pull in complementary and integrative approaches that she didn't know and I didn't know to offer her, until shortly after a friend of mine had another diagnosis and she had a completely alternative path because conventional options weren't available to her. They just weren't going to provide her a curative option. So she introduced me to this other side. And through that process, I came to learn about the book Radical Remission, and we can kind of talk about that a little bit more, but that is the foundation of our practice.
Oh, yeah. Tell us, please, the 10 healing factors and what that entails. You brought it up, so we have to just go down that path, and we can always come
Yes,
back to
love
more.
it. Absolutely. So Radical Remission research was done in the late 2000s, 2005, 2010 timeframe, by our colleague, Dr. Kelly Turner. She researched what spontaneous remission cancer patients were doing to heal because it wasn't documented anywhere. So she traveled all over the world and went to 10 countries in 10 months and interviewed patients and their healers, and then dove into the medical journals and learned more and more about what these people did to heal, and found that there were 10 common factors among all 1,500 cases that she researched. And those things are, drumroll, um, three physical, believe it or not. Out of the 10, there's only three physical. So exercise and movement is one, changing your diet, no surprise,
Hmm.
and then including herbs and supplements in your healing plan, but from a licensed practitioner, which we are not. We refer out for that. But it is important that that is something that someone gets testing specific to them so that they know exactly what's going on in their body. We fully believe that people are not statistics and very individualized. So the kind of bio-individual perspective is really important. So moving into those mental, emotional, spiritual factors that we also have, spiritual connection, making sure that you feel connected in some way to something greater than yourself, having
Hmm.
an empowered attitude toward your diagnosis and your treatment, and feeling really comfortable with your practitioners and having a good, open relationship with them. increasing positive emotions every single day, making sure that you're accessing those emotions. A big one is releasing suppressed emotions. That's kind of where we put under this umbrella, the traumas, the stresses, the all the things that people witness every day that are more challenging, kind of fall into that releasing suppressed emotions. And then a couple of the other interesting ones that people may not expect, following your intuition. That was something that came up in every one of the interviews, and that's a really powerful healing factor that people don't know to tap into. And I kind of feel like these are obvious after you hear them, but really, really, really important is having purpose. We call that strong reasons for living, and increasing social support. There has been so much science around the benefit of having a strong social support system. Yeah. And as we do this work, we share the science behind each one of these and how they boost your immune system. And so me, as a non-cancer patient, but as a health seeker, and I'm referred to as a pre-viver because now I do have a large family history after my sister, my cousin, my aunt, my other aunt, grandmother. So a lot of breast cancer kind of came out of the woodwork since then. So as a pre-viver, which is someone with a strong family history, I choose to utilize these healing factors in my life to keep myself in a balanced, healthful state.
All right. So if you want more good info, you want to keep following Liz and I, just click on the link down below.